Hello friends, I am Dr. Asmat Fatima and today we learn about the tips for locating the root canal orifices. So there are several rules and laws by which you can locate the root canal orifices when you are doing your root canal treatment or when you are doing your access opening. So you all know that for any successful root canal treatment, the first and foremost thing to do is you have to do a proper access opening. If your access opening is good enough, that means if you have a straight line access, then obviously your other steps of root canal treatment will be very good. So Krasner and Rankow, they have given several laws, and that laws is known as laws of pulp chamber anatomy or laws for locating the root canal orifices. So there are several laws and we'll see all these rules and laws one by one. So the first law is the law of centrality, and this law suggests that the floor of your pulp chamber is always located in the center of your tooth at the level of CEJ. So in all the cases, whether you are doing your central incisors, your canines, your premolars or molars, in every case where you will find the pulp chamber floor always in the center of the tooth and always at the level of the CEJ. Second law is the law of concentricity, and this law says that your walls of the pulp chamber, they are always concentric to the external surface of the tooth at the level of CEJ. So if in the tooth, suppose if it is a maxillary molar, so if you see any kind of projection on one side, then your pulp chamber walls will also be projected towards that side. So whatever the anatomy of the external surface of the tooth, there will be the same in the internal surface of the tooth. That means your external surface of the tooth reflects the anatomy of your internal surface. So always, whatever the case is, your internal walls of the pulp chamber, they'll always be concentric to the external surface of the tooth and where at the level of your CEJ. So the third law is the law of CEJ. So this cemento-enamel junction, it is one of the most important and repeatable landmark if you have to locate the position of your pulp chamber. So this landmark is very important because as you have seen in the first law also that your pulp chamber will be located, floor of the pulp chamber will be located in the center of the tooth at the level of CEJ. In the second law also, the law of concentricity, it will be at the level of CEJ, and here also in third law, this CEJ is the most important landmark. And what does this law suggest? That the distance from the external surface of your clinical crown to the wall of the pulp chamber is same throughout the circumference of the tooth at the level of CEJ. That means that from wherever you go from the external surface to the wall of your pulp chamber, the distance is always the same throughout the circumference of the tooth. And this is at the level of your CEJ only. Fourth law is the law of symmetry 1, and here in this law there is an exception that except for maxillary molars. So all your orifices will be located at an equal distance from a line drawn in the mesiodistal direction through the pulp chamber. So if you draw a line from the mesial towards the distal part, then your root canal orifices will always be located at an equal distance from that line. Suppose your mesiobuccal, in this figure you can see in the mesiobuccal canal, if it is located at an x distance from your mesiodistal line, then your mesiolingual canal will also be located at the same x distance. So the orifices, they are always at an equal distance from a line drawn from mesial to distal direction, and this line will be an imaginary line. Then fifth law is your law of symmetry 2. Here also your maxillary molars, they are an exception, and here the orifices of the canals, they lie on a line perpendicular to a line drawn in the mesiodistal direction. So already in the first law of symmetry you have drawn a line from the mesial towards the distal direction. Here in this figure also you can see there is an imaginary line from mesial to distal, and this law suggests that your root canal orifices, they will always be located on a line which is perpendicular to this mesiodistal line. Here you can see in this figure also that there is an imaginary mesiodistal line and there are two lines which are perpendicular to that line, and your root canal orifices are located on that line also only. sorry. Okay, so the first law of symmetry suggests that your orifices will be at an equal distance from an imaginary line passing through mesial to distal direction. And your second law suggests that your orifices will always be located on a line which is perpendicular to a line which is going through mesial to distal direction. Sixth law is the law of color change, and this law suggests that your pulp chamber floor color is always darker in comparison to the vertical surrounding dentinal walls. So always your pulp chamber will be darker in color. So this is the very simple law. Next one is the law of orifice location 1, and this law suggests that your orifices are always located at the junction of your dentinal wall and the floor of the pulp chamber. So always you will find your orifices at the junction where there is your wall of the pulp chamber and at the junction of the floor of the pulp chamber. So in this figure you can see that the first figure suggests that there is a dentinal wall, there is a wall of the pulp chamber, and here floor is also there. So the orifices, they are located at the junction of the wall and floor. Next law is the law of orifice location 2, and this law suggests that your orifices of the root canals, they are located at an angle of the junction of the dentinal wall to the pulpal floor. First law suggests that your orifices are located at the junction of wall and floor, and second law suggests that orifices are located at an angle to that junction. So your root canal orifices, they are not located straight, they are not going straight. So if you want to locate your mesiobuccal canal, then you have to go from a distolingual direction. Okay, then only you will be able to locate your mesiobuccal orifice. So it is located, and this figure also suggests that your probe is not going straight, it is going at a particular angle. So your orifices are located at an angle of the junction of dentinal wall and the pulpal floor. So you all have heard a term which is known as mouse hole effect. What is this mouse hole effect? So when you are preparing your axis opening and when you are extending your walls of the pulp chamber, then you must have seen that sometimes your orifices, they are not located entirely on the pulpal floor, and some part of your orifice is extending or hiding into the axial wall, and you have not cleared your axial wall enough so that your pulp chamber can come on the your orifice can come on the pulpal floor. So this creates a mouse hole effect. This first picture, the picture A, it suggests it's looking like a mouse hole. That means your orifice is not entirely located on the pulpal floor, and the picture B is the correct way of preparing the axis opening. That means your orifice, you can see, is entirely located on the pulpal floor and not extending into the axial wall. So this is the correct method of your extension of your pulp chamber walls. This one is the last law, which is the law of orifice location 3, and this law says that your orifices of the root canals, they are located at the terminus of the root developmental fusion lines. In this figure you can see there are some sort of lines going on in the pulp chamber floor, and these are known as the root developmental fusion lines, and you can also call them the dentinal map. So where these lines, they will locate you towards the orifice of the root canal. So always the orifices are located at the terminal point of these developmental fusion lines. So if you follow your dentinal map correctly, then it is very easy for you to locate your root canal orifices, and if you follow all these laws of Krasner and Rankow, then your root canal orifice location will become a very easy task. So that's all for today's video. If you like my video, please hit the like button, and please subscribe my channel. Bye. Thank you.